Hi there, this is Dr. Linda Burke, board-certified OBGYN physician, blogger, and author of the prenatal book, The Smart Mother's Guide to a Better Pregnancy. So I'm attending ACOG's District 12 meeting. We are located here in Florida. The District 12 is the Florida component of ACOG, and I'm a committee member that tries to minimize complications for pregnant women. We try to think of ways that we can basically make you all safer in the hospital. So, I want to share, some information that I think is very helpful to you. For the past year, the leadership at ACOG has been marching up to the Hill in D.C. to try to get the lawmakers, the congressmen, the U.S. senators to do the right thing in terms of keeping pregnant women safe. And of course, their requests have not been, were not acted upon. People said yes, but when it came time to sign bills, they basically said no until Serena Williams' story about her postpartum pulmonary embolism, also known as a clot in the lung. Once that story hit the media space, then all of a sudden everybody wanted to do the right thing. Long story short, there's now a law that protects pregnant women in terms of trying to reduce complications in the hospital setting. So shout out to Serena for helping pregnant women have a better outcome in terms of pregnancies, and hopefully they won't experience what Serena experienced when she had her baby. So that's the first thing I wanted to share with y'all. Second thing that has come up, which I found very helpful and interesting, is a discussion about postpartum exams. Usually postpartum exams are given at 6 weeks after the baby is born, and there's a new initiative now that is trying to promote a 3-week exam, actually to try to give pregnant women, actually postpartum women, two exams within that 6-week period, as opposed to one exam at 6 weeks. So why is this helpful? It's helpful because if you are someone who's had complications such as gestational diabetes, theoretically you need to be tested 2 weeks after the baby is born to make sure you no longer have diabetes, because there's a certain population, a certain percentage of people who can still have diabetes even after the baby has been born. And so that is important, because if you're a diabetic, but you don't know that you're a diabetic, then you can have significant complications, diabetic retinopathy, peripheral neuropathy, all kinds of issues that involve your limbs and involve your vision. So I think this is a very important thing. The same holds true for women who had preeclampsia or hypertensive issues while they were pregnant. In the third week after you have a baby is a much better time to make sure that everything is okay, as opposed to waiting 6 weeks. And again, for women who've had preeclampsia, that's kind of like we call it a surrogate marker, or, in plain English, a heads up that you could develop heart disease in the future. So these are things that are very important. And also, what's also exciting about this recommendation is that the recommendation is that these third week postpartum exams can be done via virtual conferencing. So in other words, telemedicine can be used as a way to give postpartum checkups. And that's important because just like I'm speaking to you via camera, you will not have to go into your doctor's office to have this postpartum visit. You can actually do it from home with, potentially your camera. So that's really, really exciting. Of course, now if you need a pap smear, that's a different story. You will have to go to your doctor's office to be checked. One last thing that I thought was also very interesting: if you are a woman who is older and who is thinking about becoming pregnant, we need to identify your risk factors. And so one of the recommendations is that if you are pregnant and you are obese, or even if you're over 35, that you get a cardiac echo, which is basically an ultrasound taking a picture of the heart, looking at how big it is and how fast it moves, to make sure that you don't have any heart problems such as undiagnosed congestive heart failure or something of that nature. And even if you don't have heart disease, but let's say you have a strong family history of heart disease, a cardiac echo is recommended. So these are things that I want you all to know about so that you can be empowered and advocate for them when these things become official medical recommendations, which will probably be next month. So I hope you enjoyed this information. If you did, please share this video with your friends. And as always, it's wonderful talking to you, and I will see you all next time. Thank you for listening.